Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Thanks for joining me this week as we continue our multi-part series on pain, and as we're coming out of a couple of weeks on silent inflammation and nutrition, and we've been speaking about how the food that we put into our body can cause a condition called silent inflammation, which is a term and a subject matter that's really been illustrated well by Barry Sears, S-E-A-R-S. He's a PhD, written a number of books basically focusing on inflammation and cellular inflammation. And I would highly advise that if you haven't read his work, again, it's S-E-A-R-S. He's really published some great work, and we've been talking about food as medicine and utilizing food as medicine from a biochemical perspective in terms of helping our bodies reduce the inflammatic load, which is a cause of pain. Like I've been sharing with you, I'm going to give you the macro trauma. As we get into some later weeks here, we're going to be talking about falls downstairs and raking leaves, and many people these days have been hurting their backs, shoveling snow. We call those macro traumas, a car accident, a sports injury. Where these weeks that I'm spending with you is really going into the cell and looking at the chronicity of illness as it's caused by micro trauma and cellular inflammation, or silent inflammation when we talked about nutrition. Now, today's show, we're going to leave the nutritional piece of silent inflammation and move more towards the psychological. Remember, the show is based upon something called the triad of health. The triad of health is physical, nutritional, and psychological. So the three components every day of our lives: we have to think and use the noodle between our ears, we have to put food in the hole under our nose, that's the nutritional, and we have to use this miracle of life called the human body, and that's the physical. So the physical, the nutritional, and psychological come together every day to give us our health. And our job is to follow God's design for the physical, nutritional, and psychological, looking at the science, the biochemistry, the anatomy, the physiology, the histology, the endocrinology, and all of the ologies that He has given us. Ology in Latin means the study of. So bio means life. Ology means the study of. So it's the study of life. So as we look at the study of life, and we looked at this from a histology perspective, histo in Latin means cell. So ology means the study of the cell. Histology is a subject matter that when you really dive into the cell and you look at the complexity of the human cell and the fact that we're made up of trillions and trillions of these things, that our health is determined from a cellular level. Yet our healthcare system is really based upon symptoms. And symptoms many times are the last thing to show up, especially when we're talking about silent inflammation and how it produces, for instance, cardiovascular disease or a stroke or cancer. All right. So like when I lecture, I tell my audiences, what's the last symptom to show up in cancer? Well, it's typically pain. So we don't want to wait for symptoms. We want to be proactive. And part of our couple of weeks of discussion here, we've been talking about our health span versus our lifespan. I'm interested in the number of years that I'm blessed to live here on this side of eternity, but I'm more focused on my healthy years. I'd rather live good quality healthy years living a wellness lifestyle, obviously avoiding the tragedy and trauma. Many of that I can't prevent, so I'm not really focused on that. We're going to focus on the things we can control. Silent inflammation we can control with better knowledge, which creates literacy, which creates passion, and finally it creates action. And I'm looking for action providers out there. So in preparation for today's show, I was thinking about you guys and saying, who are my action providers? Who are the people out there that are actually going to take the steps? Because we can't rely upon the government. It's not like they're going to go shut down every fast food restaurant and stop the Coca-Colas and the Pepsi-Colas from making their products, and Nabisco and General Mills and Kraft's and Tyson Chicken and the rest of them. We're not going to go shut down all of those food companies because the country would go into a depression. But what can we do as followers of God's plan? And I always go back to when I was a kid. I grew up in the 70s, and back in those days, in my community that I lived in, the dads got up, they went to work. When you came home from school, mom was there, she took care of you, and there was a decision maker in the house. And in my house, that was my mom making the decisions as to what we were fed, the direction of raising the children. And I look at it from the perspective that in every home, there needs to be a person who's really going to learn this material to make better decisions for their families. Because, when we look out to the government and other people, they're not going to do it for us. So let's empower ourselves with knowledge and literacy. Let's take back our health in 2014. And I started this year off by defining what I wanted you to do with a health journal. And that health journal is something that you should be writing in, at least once a week. You're going to keep tabs of maybe this show, maybe reading people like Dr. Sears, Cordain, and other authors that I talked to you about, becoming more knowledgeable in the subject matter. Because that's what's important. As with Luke 1:37, for with God, nothing is impossible. It is not impossible at any age for all of us to try to obtain a better level of optimal health. Now, in saying that, last Sunday, I go to Calvary Chapel, Old Bridge, and Pastor Lloyd is my pastor. And I saw in the flyer that they hand out before service that there is, on March 15th, from 10 a.m. to 2 p.m., there's an elder. His name is Joe. His last name is Bonacci. He's a cancer survivor, and he's doing a seminar on redefining suffering. And that kind of caught my eye, because here I am doing a multi-part series on suffering. And this little flyer, it's interesting. He has, as believers, we need to suffer. And he gave 5 bullet points. And I read them, and one of them was, start with number 1, in order to grow and mature. So we need to suffer in order to grow and mature. Now, remember I shared with you, I went to the Bible and I said, where does this word pain come from? Well, it's in Genesis. God gave Adam and Eve, after they sinned, he said, you will have pain in childbirth to Eve. And to Adam, he said, you will have pain in work and to toil. And it's right there, right after the fall, of man, that God used the word pain twice in Genesis. Now, here's a gentleman who's going to be doing a seminar on suffering, and I think back to when I made the change in my life. I was a pre-med student, and I walked into a nutrition class, and this changed the way I thought about myself. And because I wasn't necessarily the healthiest guy in the world, and I started to grow and mature through suffering by having chronic sinus infections. I was just chronically sick when I was a teenager. And I look at suffering, and I'm anxious to listen to this seminar that he's giving, because we need, the second bullet point is to be better equipped to serve. The third one is that we could be a source for support to others. The fourth is so God could use us more effectively. And the fifth is to sometimes remove those things from our life that separate us from God. So suffering, pain, and I think the 5 bullet points that this gentleman illustrated on this flyer really it took the words right out of my mouth as to why pain in physical, nutritional, and psychological does the same thing. So if you want more information about the seminar, contact CCOB on March the 15th from 10 a.m. to 2 p.m. Now, as we dive into the psychological, we're going to be looking at a relatively complex subject matter, meaning that our psychological health, the way our brain is designed to process information, our everything is neurological. Our body's hardware, our CPU, is in our brain, our spinal column. It tells every organ to work, right? The heart wouldn't pump unless there was an autonomic nervous system. We wouldn't digest food. I wouldn't be able to move my body. I wouldn't be able to think. So this brain and the way we process information is very, very important. But as with life, there comes stress. And there are physical stressors, there's nutritional stress, and there's psychological stress. And we can't be naive to the subject matter that anxiety in our life, sometimes even depression through periods of our life, and this stress causes our physical, nutritional, and psychological, and yes, stress produces pain. It causes biological reactions. Our biology will react to an adverse stimuli. So that adverse stimuli can be physical, mental, emotional, and it disturbs our body's homeostasis. Now, homeostasis means balance. So the balance of the physical, nutritional, and psychological is disturbed by stress. So here is this stress. And by the way, there's very, very good forms of stress. If I want to make myself into better shape, I go to the gym, I work out and train. That's called stress. And my body responds to the stress by becoming stronger, faster, maybe better developed, more tone, right? More flexible. Maybe my vertical jump goes up, my 40-yard dash improves. That's stress. So there are good forms of stress, but then there are also the bad forms. And the bad forms of stress adversely affect our body's balance or homeostasis. And a lot of this is done through a series of hormones in your body. Again, this is the brain responding. The brain, there's something in your brain called the pituitary, and the pituitary gland, which is regulated by something called the hypothalamus. This is in your brain. This sends out various chemicals to things like your thyroid, your adrenal gland, your ovary or testes in the male. These are glands in the body that are communicating with your brain. So if your body is under stress and the adverse type of stress causing an imbalance, well, the downstream effect of that stress, one of the many things that could happen, is pain. So many times patients will present with relatively normal blood values, but they'll talk about kind of feeling weak or having some insomnia, maybe some GI problems, maybe not moving their bowel the way they should. They're getting sick often, frequent, low resistance. They have a low sex drive or muscle pain, joint pain. They have a headache every now and then. With women, their PMS symptoms get worse. And it's sort of like they're gaining some weight. And they're in this sort of process of psychological stress having an effect on their physical being. And this is even with people who maybe are eating really well. But that stress load causing this adverse reaction eventually leads to exhaustion, fatigue, anxiety. We call it adrenal fatigue. And the patient can end up with like the inability to cope, lack of concentration. Many times they'll express what we call brain fog, being irritable, particularly in the afternoon, waking up tired, actually waking up after 8 or 9 hours sleep and they're still tired, maybe some mood disorders. Many times people will suffer from indecision. They just can't make the decisions like they used to. And yet their blood values maybe are coming back normal. This is many times in the late 30s or the 40s, 50s, and 60s that we see this. During the years of having children, raising children, jobs, maybe losing our jobs, this kind of stuff. And this type of a roller coaster of stress produces these disorders that aren't necessarily named diseases yet. But this type of a person or organism in biology is on a road to developing a disease. Make no mistake about that. Like I shared with you when we did osteoporosis. Osteoporosis many times is a downstream effect of an upstream marker like stress, years and years of stress. So we go through these years of sleep disturbance and GI problems and, chronic susceptibility to being sick. Maybe we're have some anger, we have some worry, pessimism in our lives. We're overeating, we're overworked, we're full of stimulants like sugar, caffeine, and nicotine, and this kind of neglecting relaxation, this type of process is now happening in the body. So I've set you up. Let's just say out there in Radio Land, some of you guys are dealing with the kind of stress that we can avoid, or maybe the kind of stress we can't avoid, like the loss of a loved one, going through tragedy or trauma in your life. Those are stressors too. I'm not just blaming, lifestyle on these types of stressors, because I'm setting you up for next week's show, which is if we're in this life together, which we all are, and we're looking at lifespan we're looking at health span as opposed to lifespan, we now have to learn that inside of us, these hormones and various chemicals are going to react to this external stimuli. The external stimuli are the way we think, the way we eat, and what we do with our physical body. And as we're kind of on this road of utilizing these hormones as we age and we're going for our bloods and we have a health journal, I'm going to teach you over the next couple of weeks. We're going to get back into some of Dr. Sears' work on silent inflammation and how it affects the brain, because that's a very, very important subject matter. We're not going to leave silent inflammation. We talked about silent inflammation and nutrition, but we have to get back to how it affects the brain. So as we leave this week's show, get ready for brain conversation, psychological health, and how as Christians, or in those of you who listen to me who are not Christians, we want to honor God by allowing His plan into our lives from a physical, nutritional, and psychological perspective, and this will reduce the amount of physical pain in our lives. Okay, so thank you for listening to me, Dr. James Proodian, this week for the By Design radio program. If you'd like more information about me, go to ProodianHealthcare.com. You could write me an email. Feel free to become a blog member. And I look forward to picking up next week as we dive into silent inflammation and psychological health. Have a blessed week.